When you work as long as I have in emergency medicine, you see a lot of interesting cases, and of course toxicology is similar. I think the most interesting cases are the ones either a challenge for you, for your skills, or they're a situation where an unusual occurrence happens. I think some of the interesting cases in toxicology are bites and stings, and we occasionally get rattlesnake bites. Those are always a challenge. The smaller patient, the pediatric patient, I can remember having a couple of those where you think of them as normally in a dose situation, you don't give as much medicine to a pediatric patient, but when you're dealing with a rattlesnake bite, you've got a same amount of toxin in a smaller patient, and so one of the things I learned early there is that you give pretty significant doses to those kinds of patients if you want them to have a good outcome. Document your swelling, because the swelling will change fairly rapidly and help you know whether you've had a serious envenomation or not. Usually these are extremity envenomations where somebody gets bitten on a leg or an arm. If they get a bite into an artery, for instance, they might die before they get to help. These commonly occur out in the rural areas. None of the first aid measures seem to be very helpful that we've studied, and you end up wanting to get to the antivenom as soon as possible. If you've got somebody who you think is acutely dying, of course, and they have an extremity bite, you know, a tourniquet, even an arterial strength tourniquet, so you're totally cutting out the circulation, could be helpful till you get some antivenom. Not a lot of good evidence that these things do much to change the prognosis. The antivenom seems to be the biggest factor. And then good supportive medical care. You know, the number of deaths per year is a small amount. It's just in the double figures or less. And so it's fairly rare these days to have death. Now that's in the United States. Of course, worldwide, it's very significant numbers.